Good morning, yogis. Welcome to Movement Matters Wellness. In today's session, we're going to be working with the hips. So this is a lovely session if you've got any stiffness going on, if you've got any pain, a little bit of arthritis maybe. It's all really nice for releasing and strengthening. It's also a really nice practice if you are pre or post hip replacement. Having said that, as always, if you are, please check with your caregivers that this is suitable for you. Excuse me. Once you have medical clearance, that's great. Please do the practice and enjoy it, but work within your own limitations. Don't exceed them, because that's just going to give you pain. If you work within your own limitations, then you're going to progress much quicker. You will need one prop for this practice, so you will either need a block. If you haven't got a block, that's fine, don't worry about it. A thick book will do. So, about that thick. That's all that you'll need for the practice. So for people that are doing this practice who've had a hip replacement, there are just a few contraindications that I need to go through. They are really important. 3 of them are seated and 1 of them standing. I'll show you the standing one when we come to stand up. So the other contraindications are when you've had a hip replacement, if you've had it posteriorly, so an incision in the bottom, then you mustn't, while you're in recovery, cross the legs. And the reason for this is it's putting pressure on that area. And most of the time, we've got staples, so we don't want to pop anything. We also don't want to dislodge that lovely new hip that's going to serve you well for quite a long time. So that's the first one. We don't cross the leg over. The second one is you must remain at 90 degrees. So if I just turn sideways and show you, we need to remain with the shoulders stacked over the hips and the knees stacked over the ankles. What we mustn't do under any circumstances is come forward, because again, you can see what that does on the bottom area. So you want to remain nice and upright. By the same token, you also don't want to bring that knee up, because you're doing exactly the same thing. So from your operation until you're guided otherwise by either your surgeon or your physios, this is your position. So I'll give you the other one when we're standing up. Oh, actually there is one more, and that is we mustn't rotate inwards from the hip. So no pigeon toes, if you like. We're not rotating the leg in. It's all right to do foot circles as long as you isolate that ankle. So it's not this sort of movement, it's just from the ankle. So those are the ones that you need to be careful of seated, and I'll go through the other one when we're standing. So make sure that you've got your block or your book ready, and we'll make a start. So we're going to come into sitting up nice and tall. If you're still a little bit sore and you feel as though you want the backrest, perfect, no problem, as long as we're keeping that tummy pulled in. So we're going to come forward and we're going to take up a lovely, nice, tall seated position. We're going to be grounding in through the feet, and we're going to be rounding in onto the chair with the bottom. What we're not going to do if you are recovering from surgery is what we normally do to find the sits bones. You just make sure that you're nice and comfortable on the seat. We're going to place the hands on the thighs, arms down, palms up, yogi's choice, and we're going to take the shoulders up, back and down, away from the ears. We're going to imagine that rope pulling us up from the head so that we've got a nice long torso, some nice stretching motion in the middle body. Just close your eyes for a second and imagine, picture what your body looks like, what shape you're making now. So make sure that you're visualising yourself sitting up nice and tall. We're not drooping forward from the middle, we're up nice and tall. And we've given ourselves lots of lovely space in the chest area to breathe. So if it feels good for you, close your eyes. If not, just look down to the ground. And now we're going to take 3 nice deep breaths in and out. So inhale and exhale. Ooh. Inhale and exhale. One last time. Sigh it out if it feels good. Inhale and exhale. And if you've had your eyes closed, gently open them. Take the arms down to the side, palms facing forward. We're going to do 3 nice big sun circles, but I want you to do them at your own breath pace. We all breathe differently, so I'm not going to guide you on the breath with this one. You do it at your own breath pace. Just know that as you breathe in, you raise the arms up, and as you breathe out, you lower the arms down. So there's no rush. In fact, the slower you go, the better, to combine that breath and movement. Remember, when we work mindfully, we gain more benefit, rather than just being mechanical, not thinking about what we're doing. So work mindfully. Take the hands down, and we're going to raise the arms up. And lower down. Raise the arms up. And lower down. Last one. Raise the arms up. And lower down very gently. Bring the hands to the thighs. We're going to bring the shoulders forward. Inhale as we raise them up. Exhale as we lower them down, bringing the shoulder blades together, and relax. For the next posture, you can either stay in the center of the chair, using the core to build strength and protect the lower back, or if you prefer, you can wiggle your way to the backrest. We're going to have 2 options for how high you're going to raise your leg. All depends on how you're feeling today. You can either just take the leg out and raise the foot a few inches off the ground, or you can activate this quad and bring it higher. If you bring it higher, you can have a little bend in that leg. It doesn't have to be locked straight out. And what we're going to do is some pointing and flexing just to release that calf muscle and start building a little bit of strength and flexibility in the ankle. So wherever you want to be, raise that leg out. And as we inhale, we're going to point the toes forward. And as we exhale, we're going to bring them back. So we're going to inhale and point, exhale and flex. Work at your own breath pace. And lower that leg down. Just give that quad muscle a little bit of a rub. Release any tension that you might be storing there. And we're going to bring the other side out. So remember, as we inhale, we point. As we exhale, we flex. Up nice and tall. Try to make sure that we haven't folded forward. It's so easy when you're concentrating on a certain area to forget the posture. So keep checking in and making sure that shoulders are back and down and we're up nice and tall, tummy pulled in. So we're going to point and flex, point and flex. So inhale and exhale, inhale and exhale. We're working now at your own breath pace. And lower that leg down, give that muscle a little rub. And now if you are seated back in the chair, just come forward a little bit, making sure that you're still at the all important 90 degrees. Toes are pointed forward, knees are pointing forward, hips are pointing forward, shoulders are back and down. We're going to take our hands onto the thighs and we're just going to do some very gentle circles from the waist. So it's not a great big movement, it's just some little circles from the waist, just to wake up this lower back and the hips. Now please, if you have had a replacement, make sure that you're not coming forward like this, because remember, you need to stay at this angle. So up nice and tall, and we're just going to make these circles from the waist. So if I show you from the side, it's going to look something like this. I'm going to go back around the other way now, so change direction. Always feels a little bit awkward when you go in the non-dominant side. And gently come back up to sitting. Make sure that you're nice and comfortable on the chair. And we're going to do some cow-cat postures. Now I'm going to again give you a couple of options here. If you are post-surgery, we're going to place the hands on the thighs. As we inhale, we're just going to pull the shoulders back And as we exhale, we're just going to make a gentle movement forward. So we inhale and we exhale, pulling the tummy in through to the back, but we're not rounding down. It's a nice gentle movement. If you aren't post-op and you want to take the movement a little bit further, then we're going to inhale and exhale. Inhale and exhale. So yogi's choice, make sure that you're very careful as you're working. As I say, work mindfully. If anything hurts, stop. If anything's too uncomfortable, then pull back a little bit. Because if you've got discomfort or pain, you know you've gone too far. Okay, so let's do some nice cow-cat stretches. So we're going to inhale and exhale. Inhale and exhale. Work now at your own breath pace. And relax. Just close your eyes for a second and have a see how you feel. Think about any areas that aren't feeling too good with these movements. Hopefully there won't be any, but have a little think about how that went. Notice how you're feeling now. Do you feel a little bit looser? Was it not too good? We always need to look at both sides, what felt good and what doesn't, so that we can adjust what doesn't and enjoy what does. Okay, so we're now going to do some nice, ever so gentle twists. So what we're not going to be doing is forcing ourselves right round. We're not going to be doing that. It's just going to be a nice gentle twist. Shoulders are down, they're in line, so we've got one up here and one down. Everything's nicely in line and it's very gentle. It's a very gentle twist. So we're going to bring the arms down by the side. Inhale. As we raise the arms up, we're going to exhale to your left. We're going to take one palm to the side of the leg and the other to the side of the chair. And we're just going to take a few nice breaths here. On the next inhalation, we're going to come forward. We're going to raise the arms up. And as we exhale, we're going to twist to the opposite side, making sure that both buttocks remain on the chair. And we're not pulling the knee over. Everything is still in line. Tummy still tucked in. Shoulders are relaxed and down. And just breathe and enjoy this gentle twist. On your next inhalation, we're going to bring the arms up. Exhale and lower those arms down. We've got one last movement seated and then we're going to go into standing. So from here, we're going to raise both arms up as we inhale. And as we exhale, we're just going to take a nice gentle stretch over to the side, making sure that both of your bottom cheeks are still on the chair. We're not twisting forward. Everything is in line. And just breathe gently. Inhale as you come back up. Exhale as you lower down to the other side. Hold on to the chair if that helps. You can press into the chair if it helps to keep both of your bottom cheeks on the chair. Make sure that everything's in line. Inhale as you come up. And exhale as you lower down. Give those shoulders a roll. And very steadily, we're going to come up into standing. So we're going to move the chair around. And we're going to make sure that it's a good distance from us so that if we get a little bit dizzy, we can hold on. Okay? So from here, just ground the feet down. Take the shoulders back and down. And we're just going to do some heel raises just to release any tension in that calf muscle, in the hamstring, and just start to activate the glutes and the quads. So just placing the hands gently on the chair. You can have a little bend in the knees if that feels better for you. And we're just going to start by coming up onto the toes. And very, very gently and slowly we're going to come back down. So coming up onto the toes, onto the balls of the feet, and lower back down. And lower down. Try not to make it a rocking motion. We want everything to be slow and controlled and mindful. So we come back up and we lower down very, very slowly. So we're working the muscles eccentrically. Very, very slowly. Let's just do 2 more of those. And just give those legs a little shake. And then from here, excuse me, we're going to start activating those glutes. So the glutes, the glutamus maximus, is the big muscle that runs through the bottom. And we want to start building strength in that muscle, because the more strength we've got in that muscle, the more stable the hip is going to be. So we're going to take 1 foot behind. It's only a step. We're not trying to aim right backwards. It's just a step back. And we're going to bend both knees and come up. Bend and come up. You should be feeling that all up the leg and into that glute. Making sure that the toes are facing the same way. The knees are facing the same way. And the tummy is pulled in. And now we're going to do the same movement, but we're going to come onto the ball of the foot. on the back. So we're still on the sole of the foot, on the front foot, but we're coming up onto the ball of the foot on the back. Bend those legs, and we're going to do the same thing. Now notice, now that you're up on the ball of your foot, you've started to activate the quadricep muscle as well, this big muscle in front of the leg. Just do one more of those. And then we change sides. So we're going to take the opposite foot back this time, making sure that both legs are bent. Both feet at the moment are flat on the floor. And we're going to inhale as we come up, exhale down. Inhale and exhale. You'll feel a nice stretch there as well in that back foot, in the Achilles tendon, in the heel, and up through the ankle. Now we're going to come up onto the ball of the foot, bend those legs. Place the foot back down, come back forward, and just give those legs a shake. From here, we're going to go into lateral extensions. So to start, we're going to bring both of the feet flat onto the ground, rounding down through the legs, shoulders are back and down. We're going to take now the weight into the standing leg, so the one that's closest to the chair back. We're not going to use this as a balance, so do hold on to the chair. You know, normally we would say, oh, we'll make it a balance, but for today, we just want to work that hip. I don't want you thinking about, oh, I'm balancing, I'm working the hip. Work mindfully into that hip. So take the weight into the standing leg, making sure that we're not pushing it out. So we're in a nice straight line. We're going to flex the foot of the free leg, the freestanding leg. We're going to make sure that the hips stay facing forward, so we're not twisting into it. Toes are forward, hips are forward. And we're going to raise and lower. Raise and lower. And just give the legs a little shake. Now I did say at the beginning that there was a standing contraindication, and that is we can take this leg out post replacement, but what we can't do until you get permission is take it across the body. We don't want to be working to the center of the body. So this is fine, this isn't. So we just change sides. Rounding down through those feet. Shoulders back and down. We're going to take the weight into the standing leg, making sure we're in a straight line. We're going to flex this foot, making sure everything is facing forward. And we're going to extend and lower. Working mindfully into that movement. Working to your own limitations. Lower that leg down. Give both legs a little shake. Okay, so for the next one, we're going to come back round to this side, facing the back of the chair. Coming up nice and tall, tummy's pulled in. And the next one, we're just going to activate those glutes again. So, standing up nice and tall. Now, what we don't want to do is try and get this leg back as far as we can. Because if you see what happens, we then start to make it into a back bend. We don't want that. What we want is to just work this bottom area. So we're going to be taking that leg back just until you feel that glute activate and lower. Making sure that you're comfortable on this standing leg, so if you need a little bend, that's fine. So we're going to come up tall, shoulders are back and down, everything's pulled in, weight onto that standing leg, and we're just going to go back and down, keeping that foot flexed. Lower down, we're going to change sides. Nice and tall, shoulders back and down, weight into the standing leg, and we're just going to raise and lower, raise and lower, making sure that everything stays forward. We're not turning, everything is facing forward. And lower down. Give those legs a shake. Now this is where you're going to need your block or a book. And what we're actually going to do is place the block on the ground. You will lose my head here, I'm afraid, because I'm going to be too tall. We're going to step up onto the block. And what we're going to do is make sure that we're not just dangling with this hip. We're up nice and tall on this leg. Everything stays forward. And with this free leg, you can have a little bit of a bend in the standing leg if you like. And with the free leg, we're just going to allow it to swing like a pendulum. So there's no effort in it whatsoever. It's more of a gravity pull than you actually working that leg. Just allowing it to swing. Making sure that everything is facing forwards. And then we're going to lower that leg down, take ourselves off the block, move it over, and we're going to do the same thing on the opposite side. So coming up onto the block or the book, whichever you've got, check your posture, make sure that you're pulled in, make sure that the shoulders are back and down, everything's facing forward. And from here we're going to flex that foot, and then we're just going to allow that leg to swing. It's a lovely free movement all through the hips. Lower that leg down, step down off the block. You can just move the block out of the way now, and we're going to come back into seated. Just place the hands on the thighs for a moment, close the eyes, and notice any sensations going on within the body. Notice if you feel freer, so less stiff. If any pain that you were experiencing before is subsiding. Notice anything that maybe doesn't feel too good so that you can adjust and adapt next time. It's all about getting to know your body, working mindfully with it. Notice your breathing as well. Notice where you're breathing from. You have been working some quite big muscles in the body today, so you might be a little short of breath, shallow breathing from the chest, a little bit aerobic. Or you might be still taking some nice big, deep, slow breaths from the belly. Just notice what's happening for you. And if you are taking short, shallow breaths, just try for the moment to slow it down. So trying to extend the in-breath. And then seeing if you can extend the out-breath a little bit more than the in-breath. So if you're breathing in for 3, try to breathe out for 4. Bring your hands now down to the sides of your body, and we're going to end on 3 lovely sun circles, just to release everything off and prepare ourselves for Namaste. So we're going to inhale, and exhale. Inhale, and exhale. Inhale. And this time we're going to bring the hands down to the center line in prayer position. And we're going to place the thumbs by the heart. Shoulders are relaxed and down. Breathing is returning to normal. And we're just going to gently bow our head forward to seal the practice by sending out our thanks and praise to the universe. Thank you for joining me. Namaste. I hope you've enjoyed the practice today, and if you have, please don't forget to subscribe and like and let your friends know about the page. Thank you so much.